Hello, everyone. It's great to be with you. I am Dr. Merkle, Doctor of Chiropractic, board certified in clinical nutrition, and I've been teaching laboratory analysis for about 35 years. It's been a long time. Continuing education, I teach doctors laboratory analysis and nutrition. For virtually any drug, for any disease, there's a natural solution. There's a safe natural solution. That's what I try and teach to doctors. And I try to tell them is how to manage things. Whatever problem you have, whatever problem you have, there's a blood test that should be able to give you some guidance on the level of disease. And then when you start a vitamin diet regimen, you see it improve. Now, some people ask, well, what vitamins do I need to take? Well, that goes with experience and testing. Now, you might test vitamins individually. And let me show you here. You might have, this is a blood test of a real patient. And you might do test of vitamin D. Now, this patient's vitamin D is great. And you might say, okay, that level is good. If it were low, it'd tell you need it. If it's high, then you might be taking a little too much vitamin D. You might run a B12 or folic acid. You might run your fish oils and things like that. That's part of our cardiac panel. But you can also run the right there, B12. It's a little bit low here. You can buy vitamin K. And there's different reasons why you would order those tests. B12, suppose somebody's anemic. Now, here's the thing about lab work and working with somebody who has experience with nutrition and natural health care. But this is well known too in this instance that somebody's got anemia. They might need iron, but if you look at their serum iron and ferritin, you see those are optimal. They probably don't need iron. They probably need B12 and folic acid. Now you look at the MCV, MCH, and MCHC to get a little more information there, which are blood tests. And then you might put them on B12 and folic acid and maybe B6, even without testing those vitamins individually, because it's well known that common deficiency of those vitamins can cause anemia. And so you might look at that, and some people will recommend a B12 shot. Now, a B12 shot. B vitamins are water soluble, which means you're only in your system for a few hours. So you take a B12 shot once a week or once a month. How long is that really helping? Just maybe a few hours. And is anyone ever deficient in just one B vitamin? Anybody ever deficient in one B? No, you're never deficient in one vitamin or B vitamin. And so we never recommend B12 by itself. We always put a B complex in with it because we know that you are probably deficient in other B vitamins. You don't want to throw the body out of balance. So we'll recommend B vitamins based on that. Now you look up here and we go up to the minerals, and you might see, oh, well, we're testing a lot of minerals here on our SBN panel, SBN Science-Based Nutrition Panel. And there's a lot of electrolytes and minerals we'll test right off the bat. Now, this is part of a standard blood test, even your medical doctor will do. They may not order all of these, but mine includes the sodium, potassium, chloride, calcium, and phosphorus. Now, question. Suppose that these values are all normal. Does that mean that you don't need any more calcium or magnesium? You don't need any more potassium? No, it doesn't. And here's an interesting thing that you might have to look at other lab values and other tests because your blood is so critical. The specific gravity, how much water versus elements are in it, like platelets and red blood cells, how much serum there is. The pH is so critical in your blood work that the body will take minerals from your bones and electrolytes from other parts of your body to keep the blood flowing, to keep the blood at an optimal level so that you don't die. You don't have a heart attack, so you don't develop kidney problems and those kind of things. So your body will sacrifice non-essential parts like bone and muscle to try and keep your blood at a certain level. So that is where, now over a period of time, if you are out of balance, if you're low in magnesium, your serum levels will show low. They will show low. But we don't want to wait till they're clinical low, which is where I've talked about catching problems before they're clinical. And if you see the yellow here on this blood test, and yellow are those things that are a little high or a little low, but the medical doctor is not going to acknowledge these things until they are red or blue. Anything yellow is a health level. Now, obviously, if it's clear, that's optimal. Anything that's yellow are those warning signs that it's not as good as it should be. The red and blue, those are clinical levels, means that it's bad. Blue is very bad. Blue is code blue. So yellow is warning. So all these warning signs are things a regular doctor would not see, which is why when you look at your regular blood test you get back from the doctor, it's got maybe two little bumps on it, or two little spots that show this is out of balance and that's out of balance. But then if you run it through a high level analysis, like we do with science-based nutrition, you'll see all these other areas that are warning signs. Now, wouldn't it be better to fix a problem before you fall off a cliff, you have a raging forest fire? Yeah. And so that's what we do with this. And so we can see some areas that need tweaked, like the glucose and A1C. They're not horrible. A1C at 5.7, we'd prefer it to be at 5.6. And we see other values that are not bad, but they're not good either. And the earlier you find a problem and fix it, the better results you're going to have. And so the blood work, let's say that you've got B vitamins, okay? Now, if you've got low liver enzymes, low SGOT, SGPT, and GGT, that might indicate that you're low in B vitamins. Could be very simple, just B vitamins for low liver enzymes. And so this is where an expert in nutrition and lab analysis will be able to help you with a blood test to determine what vitamins you need without testing every one specifically individually. Liver enzymes are low, recommend B complex. Maybe some other things too. Test you again, and if you got the right vitamins and that was a primary problem, we're good. Suppose liver enzymes are high. We might recommend silymarin, or we might recommend some other things. Because if it's high, you've got hepatitis, liver inflammation. That's what it is. Now, it could be due to a virus. It could be due to chemical toxins. It's well known that pesticides and herbicides and things like that elevate liver enzymes. It could be drugs, prescription drugs, very easily, very commonly elevate liver enzymes. So there's a boatload of things that can cause elevated liver enzymes. And just throwing one thing at it, it's okay to try, but then when you test again in a couple of weeks, if it's not better, that wasn't it. So that's the beauty of lab testing, is we're able to identify exactly where you're at. With experience and knowledge, we're able to provide a protocol without testing for every individual vitamin and expect to see results. Like for instance, the SED rate, erythrocyte sedimentation rate. Right here, SED rate indicates inflammation. Now, SED rate is not specific. It doesn't tell us where or why you have inflammation. It just tells us that you've got it, okay? So based on our experience and research, we know that there are some nutrients that have very good anti-inflammatory properties. Things like curcumin, ginger, bioflavonoids, and vitamin C. Curcumin is phenomenal. It's anti-cancer, anti-inflammation. It's just a good nutrient take. I take it every day. There's a product we have called SBNCC Curcumin Complex. SBN, Science-Based Nutrition Curcumin Complex. Again, turmeric, curcumin, ginger, bioflavonoids, and vitamin C. Phenomenal for inflammation. You can also use ginger, bromelain, garlic, vitamin C. Well, I already mentioned vitamin C, vitamin E. There's so many things that are naturally anti-inflammatory. And so I'm going to recommend, if you're testing with us, I'm going to recommend what I have experience with. Now, notice the word that I've experienced with. I'm not saying mine's the only way that will work, but it's a way that I have experience with. And we've got thousands of patients and many more thousands of lab work that shows that what we recommend will make the changes. Very commonly, not always, very commonly will make the results, the changes that we need to make. Because that's the most important thing. The changes is the most important thing, not the label on the bottle, It's the results on the lab work that is most important. So again, I will make recommendations. You can do whatever you want. The most important thing is get retested, make sure that what you're doing is working. If you've got liver disease, you got cancer, you got kidney disease, I will make recommendations, but if you want to try something else, I'm okay with that. Test to make sure it's working. Make sure that those cancer markers are coming down. Kidneys functioning better, liver's functioning better, your anemia is improving. But you've got to test to get your baseline to know where you're at. Testing for individual vitamins sometimes is necessary, sometimes is helpful, but we don't always do that. We know looking at the labs, we're going to get an idea of what your body needs. Now, if you come in, you got severe anemia, and we recommend B12 folic acid, we test you again in a couple weeks, it didn't change, we might run a B12 folic acid on you to see, is your body absorbing B12 and folic acid? Now, it could be, or maybe you've got some other toxins that's affecting your bone marrow. So you might be exposed to chemical toxins, heavy metal toxins, that is destroying your bone marrow, and your body's not able to make red blood cells or even utilize the B12 folic acid because it's got other problems. So this is the beauty of blood work, is we're not just treating your symptom. You got anemia, we're going to try this, but we're going to look at other things that could be causing anemia. How about this? Low protein can cause anemia. Yeah, if you're on drugs, it's affecting your protein. It's going to cause anemia. Yeah, hemoglobin is protein. You need that red blood cell needs protein for your body to produce red blood cells. And so if you are on certain drugs that affect your digestion, it's going to create a problem. I'm kind of get off track here, but this is really cool. What is a primary leading cause of low protein in our culture today? What causes lack of protein? Prilosec, the little purple pill. The proton pump inhibitors, the ones that reduce your stomach heartburn from eating bad food. You get this acid buildup and you got a stomach ache. And so you take Prilosec that reduces the stomach acid and you feel better. But listen to this, you need optimal levels of hydrochloric acid to stimulate bile secretion and gallbladder function. And what do you need to digest protein? Hydrochloric acid. Your proton pump inhibitors reduce your body's production of hydrochloric acid. Therefore, you can't digest protein. And the protein that's in your stomach, it's not being digested. What's happening to it? It's rotting. It's putrefying, which gives you more indigestion, which means you're going to take another Prilosec or something stronger to reduce your indigestion. And as you do that and your digestion gets worse and worse, it may lead into Crohn's, colitis, that kind of thing. And so you've got to go to someone who knows and understands how the body works. She has Crohn's disease, ulcerative colitis. We have reversed those, not because we treated that, but we tested the body and we were able to see what that patient should do. And if we get it right, results come pretty quick, really. Results on these things can come within days, a couple weeks. And we've had children, adults that were ready to get their colon removed because that's as far as medicine, that's the best medicine had to offer, is to take their colon out. And within weeks, days, truly, weeks, they were back to normal. Back to normal. Maybe 90% normal. And one little girl I'm thinking of, 6 years of age, supposed to get her colon removed at 6 years of age. Now she's over 20, perfectly fine. Truly, the doctors wanted to cut this little girl's colon out because she had no bowel control. And then after just a few days of working with me, working with us, we got her colon worked out. Now, what would her life have been like if she had had a colostomy at age 6? Yeah. She's alive and well today because her mother wanted something better for her daughter than a colostomy at age 6, and yet that is the best that medicine had to offer, was a colostomy. Now, I'm known getting off, but if she had had colostomy, what would her health have been like? Poor, but also her quality of life would have been horrible too. I know I'm getting off. topic here. But the blood work shows us what we need to do for virtually any condition. There are things we do to get you healthier. And if you get healthy enough, doesn't really matter the name of the disease. But we've got to test you properly. If you don't test properly, you might miss something very important. And that's why we're going to check some key areas. Like if you're low in vitamin D, we know you're probably low in A, D, E, and K, the other fat soluble vitamins. And if you've got inflammation, we're going to recommend vitamins for that, liver, kidneys, diabetes, whatever you've got. There are protocols that we're going to recommend. And if you get a patient who's compliant and follows the program, you're going to get good results. That's really what we do. It's all about labs. The condition of the body is more important than the name of disease, and how you feel is no indication of how healthy you are. Truly, how you feel is no indication of how healthy you are, and that's why you'll find conditions and diseases, cancers in the blood long before even medicine is going to find it if you use our system and our protocols. Hope this has been a benefit. Hopefully you all get tested and check your score. Don't wait. Check your score as soon as possible. Have a great day, everyone. I'm Dr. Merkle.